after Aaron Rodgers endorsed it to treat COVID-19. In a clinical trial, the antiparasitic pill Ivermectin was shown not to be an effective treatment. Valley News Team's JC Dodd spoke with a local expert who says people shouldn't rely on a drug that hasn't been proven or proved to work when there are effective treatments readily available.
When the pandemic first hit, researchers began testing various drugs to try and find a treatment. In clinical trials, treatments for HIV, rheumatoid arthritis, and ivermectin were tested to see if they effectively treated COVID.
Across the board, all these repurposed drugs, they did not help COVID-19.
Dr. Nagpal says in one trial, ivermectin did look like an effective treatment, but the authors of the study recently retracted their findings.
Turns out that the data was questionable in the clinical trial, so we can't rely on that anymore.
That didn't stop athletes and celebrities from continuing to promote it.
Misinformation is also a kind of pandemic right now that we are dealing with, and that I think is a bigger problem right now as compared to the actual pandemic, because we have vaccines and we have treatments which can help most of the people, if not all.
He says when people rely on ivermectin to help their COVID-19 symptoms, they could miss the window to get treatment that actually works.
Then they come to us, and by that time it's too late to give them monoclonal antibody.
A number of people responded to our Facebook post saying they took the antiparasitic drug to treat their COVID symptoms. One woman says after 5 days of taking the drug, her COVID-19 symptoms let up and she recovered. Dr. Nagpal says people don't need to rely on unproven drugs anymore.
Being popular doesn't always mean that it works. We have better drugs that have been shown to work.
In Fargo, JC Dodd, Valley News Live.
Well, there's also the issue of people confusing this drug with the animal one, which one person told us she hasn't been able to get treatment for her horses because it's been sold out at the feed store.